The plank is a widely known exercise for strengthening the core, but have you ever wondered if different plank variations target your core muscles differently? Specifically, how do the oblique muscles, which are essential for trunk stability, perform during a front plank versus a side plank? As you can see off in the distance, there are two specimens planking at a distance.
Core stability is key for many activities of daily living, from bending over to put on shoes to maintaining good posture while walking. Among the muscles involved in core stabilization are the internal and external obliques, which help support the spine and pelvis. When these muscles are weak, it can lead to poor movement patterns, pain, and even injury.
Our study was designed to better understand how two common plank exercises, the front plank and the side plank, activate the abdominal obliques. Both exercises engage the core, but do they engage the obliques in the same way? We hypothesized that side planks would result in greater oblique muscle activation compared to front planks.
The oblique muscles, both internal and external, are crucial for controlling trunk movements such as side bending and rotation. These muscles help maintain stability by counteracting the forces that could lead to spinal misalignment. When the obliques underperform, it places excessive stress on the spine and surrounding muscles, increasing the risk of injury.
While planks are commonly used to strengthen the core, we wanted to compare how different plank positions affect oblique activation. By identifying how the obliques respond to the front plank versus the side plank, we hope to provide more targeted recommendations for individuals struggling with poor core strength or low back pain.
The purpose of our study was to measure and compare abdominal oblique activation during front planks and side planks using EMG to track muscle activity.
We hypothesized that side planks will show greater activation of the oblique muscles compared to front planks due to the lateral and rotational demands placed on the trunk.
In this study, we used a non-experimental repeated measures design. That means we measured the oblique muscle activation in the same group of participants during both plank variations. Each participant performed 3 trials of front planks and 3 trials of side planks, with EMG sensors placed on the abdominal area to track muscle activation.
We recruited physically active young adults ages 18 to 35 who have low back pain and excluded those with any recent history of musculoskeletal pain in the abdominal region, neurological disorders, or joint pathologies. Each trial was performed for 20 seconds with 60 seconds of rest in between.
For the front plank, participants kept their forearms and toes on the ground, ensuring proper spinal alignment, like shown on the left. For the side plank, participants used their dominant forearm and foot for support while keeping the body in a straight line, like shown on the right.
We expect the side plank to result in higher levels of oblique activation compared to the front plank. This is because the side plank places more lateral and rotational torque on the body, requiring the internal and external obliques to work harder to stabilize the spine and the pelvis.
We anticipate that the internal oblique will show the highest activation during the side plank, as this muscle is primarily responsible for counteracting lateral flexion and rotation, while the front plank certainly activates the obliques. The lateral torque in the side plank should engage these muscles more intensely.
Understanding how the side plank and front plank activate the obliques is important for clinical practice. In individuals with poor core strength, low back pain, or poor posture, prescribing the right type of plank can help improve core stability and prevent further injury.
If you're dealing with pelvic instability or gait issues, such as Trendelenburg gait, incorporating side planks could help strengthen the oblique muscles, providing better control over the pelvis during movements.
By identifying which plank activates the obliques more effectively, clinicians can better design personalized core strengthening programs for patients with decreased core strength or spinal instability, ultimately improving their functional abilities and quality of life.
While this study focuses on young, healthy adults, it's important to note that older adults or individuals with specific musculoskeletal conditions may have different responses to these exercises. Further studies are needed to examine how these plank positions affect oblique activation. A wider range of age groups, especially in those with lower activity levels or balance issues.
Future research could also investigate the differences in activation between trained and untrained individuals, as well as how the plank variations affect external oblique activation in particular.
In conclusion, while both the front plank and side plank are valuable exercises for core strength, we think the side plank will be more effective for targeting the obliques. If your goal is to specifically strengthen these muscles and improve lateral trunk stability in your patients, this study will help decide if incorporating side planks into your interventions is useful. Whether you're training for sports, recovery from injury, or just trying to improve gait, understanding the muscle activation during each exercise you prescribe can help you choose the most appropriate interventions for your patients.
We need to take him to a different room though. I want to take this out and smoke it.
We hypothesized.